about the Republicans in the House of Representatives' first bid to repeal and replace Obamacare. We have a bill. It is called the American Health Care Act, and it is designed to pass through the budget reconciliation process, which means Democrats wouldn't be able to filibuster it in the Senate. It means the Republicans are counting on no Democrat support. Want to pass this thing with the bodies they have in the House and Senate, get it to the Republican President Trump's desk for his signature to repeal and replace Obamacare. It's important to note, though, it's not really a repeal of Obamacare. It's a lot of changes, very significant changes to Obamacare, but there's no outright repeal in this legislation. Now, a few things that this thing is, that we've seen so far that this thing's going to do that are really the critical elements to it. Some we like, some we don't know so much. It's going to eliminate the employer mandate, which is great for a lot of us, right? It is also going to eliminate a lot of the tax hikes, especially on upper income earners that we saw that we really hated in the original Affordable Care Act. So happy to see those gone. Interestingly, it retains protections for pre-existing conditions coverage, which is very popular but isn't really insurance. So it'll be interesting to see how that market distortion that's left into the law is looked at by conservatives. And finally, it replaces coverage subsidies and premium supports with tax credits, which a lot of conservatives are coming out and saying right now is a distinction without a difference. What's the difference between paying somebody a coverage subsidy versus giving them a tax credit to essentially do the same thing? Which leads to sort of the response that we're seeing from a lot of groups so far. So far, it's hard to find people that are really excited about this bill, with the exception of the people that wrote it. So conservatives aren't feeling this. They're saying, look, you didn't really repeal anything. You're still paying people essentially a welfare subsidy or a transfer payment. This is wealth distribution. This is not insurance. So conservatives aren't feeling it. Obviously, the Democrats don't want to see one of the key signature legislative accomplishments of the last 8 years in President Obama's terms repealed. So they're not going to help. The thing to remember about Obamacare was there's a lot of things about the law that aren't working as hoped and as intended. So a lot of the state healthcare exchanges are now limited. You've got insurers rushing for the exits, and you've got, in a lot of cases, people have one plan to choose from on Obamacare exchanges. Some people are saying the finances aren't working and they're in a death spiral now. Democrats are only too glad to stand back and let Republicans pass something that will be very easy for Democrats to blame the Republicans for actually causing the death spiral, even though there's a lot of problems with the existing law. So there's a little bit of politics there to say who actually is causing these terrible things to happen. So Republicans are saying if you're not going to really repeal this and introduce free market reforms, why would you do half measures and then take the blame anyway? Because you're going to get the blame. So Republicans not feeling it, Democrats not feeling it. A lot of folks aren't happy with the way Medicaid expansion is being treated under the bill. Thing to remember about the Affordable Care Act was most of the coverage expansion that happened through Medicaid expansion. So it's easy to cover people when you just say the government's going to pay for it. That's a very popular approach, even in states with Republican governors. As long as the federal government's going to pay 90% of that cost, you know, state governments are happy to say, sure, we'll expand our Medicaid rolls if it doesn't cost us anything. Well, we all know that money comes from somewhere, and whether the government at the state level or the federal level is paying it, somebody's paying for that. It's not free. But the Republicans in the existing law, or in the bill that they've introduced, would phase out the Medicaid expansion payments over 2 years. A lot of conservatives hate that idea. It doesn't really solve the issue. It allows the Democrats to continue to say how many people are going to lose coverage, which is the next point I wanted to make, is Democrats really have their messaging together on this. The first question right out of the gate this morning on the Today Show for the Republicans was, how many people are going to lose coverage on this under your bill? And that has been a consistent message from the Democrats, saying the Republicans are going to take away coverage from 20 million people. What they're talking about is that Medicaid expansion. The problem is it's not as easy as saying, well, we'll take the criticism from the Democrats, because they're going to get a lot of criticism from Republican governors who expanded Medicaid too. In fact, there are 4 members of the U.S. Senate, Republican moderates, who've said, we will not support any changes to the Medicaid expansion. And I'm going to try to list those for you, and of course I won't remember all of them. I'll have my Rick Perry oops moment. But it's Cory Gardner from Colorado, Lisa Murkowski from Alaska, Rob Portman from Ohio, and Shelley Moore Capito from West Virginia. I got them all. They've already said they're not going to support anything that really changes Medicaid expansion, and I think this classifies as a pretty big change, but not enough of a change to make conservatives happy. So again, nobody's happy. Democrats have their messaging together. Republicans really didn't seem to have the messaging out. In fact, on even conservative talk radio this morning, Hugh Hewitt, a former Nixon guy, said, look, I can't get any Republicans to come talk to me about this. Finally, they shamed Ways and Means Committee Chairman Kevin Brady into coming on, and Brady did a great job defending the plan and talking about it, because the issue Brady says is you can expand coverage, but if it's expanded through an expensive entitlement program or through high deductible plans that people that have the plans, have the coverage, can't afford to access, you haven't really done anybody any favors. It's still a budget buster. It's still coverage that doesn't provide care. So he's got the message, but it doesn't sound like the rest of the team has the messaging out so far. And a lot of conservative groups are saying this is a half measure. This is Obamacare 2.0. There's other conservative Republican members of the Congress who say we've got a better approach to this. It's early. And, you know, in 24 hours in a news cycle these days, a lot of things can change. But early indications are that there's not a lot of people excited about this except for the people who wrote it. I can tell you that if you're a business owner, didn't like the employer mandate, obviously didn't like the expanded payroll taxes, there's a lot for you to like here, even if politically you may not be 100% in love with it. The thing to remember is this is an introduced bill in the House of Representatives. Has to get Republican support, has to get conservative support in the House to even get to the Senate, at which point it's going to have to make a lot of changes to get those moderate Republican support in the Senate. So this is nowhere near a final bill. This is nowhere near something that is going to end up on Trump's desk. The thing is, stay tuned here. We'll keep telling you about things as they change. And remember, June 20th, 21st, we'll be in Washington, D.C., advocating for the best possible bill for our members at our NAED Congressional Fly-In. We'd love for you to join us there. Registration will be open soon, so stay tuned for that. I think that's all we've got today. Thanks for tuning in, and thanks for supporting NAED.